Scabies is a common and highly contagious skin infestation that primary care providers frequently encounter. It affects over 200 million people worldwide and is most common in resource-limited settings, especially among children, older adults and care workers. It leads to intense itching, especially at night. This uncomfortable condition is caused by a tiny mite called Sarcoptes scabiei. These microscopic mites burrow into the upper layer of human skin to lay their eggs, causing a great deal of irritation. Scabies spreads easily through direct skin-to-skin contact with an infected person. This makes close physical contact, such as hugging or sleeping in the same bed, a significant risk factor. It's important to note that scabies can also spread indirectly, although less commonly. Sharing personal items like towels, bedding or clothing with an infected person can transmit the mites. While anyone can get scabies, people aged 10 to 19 years have the highest infestation rates. Some groups are more vulnerable. People living in crowded conditions such as nursing homes or dormitories are at a higher risk due to increased close contact. Additionally, individuals with weakened immune systems are more susceptible to developing a severe form of scabies called crusted scabies. Crusted scabies, also known as Norwegian scabies, is characterized by thick, crusted skin lesions that contain a large number of mites. This form of scabies is highly contagious and requires prompt medical attention. What are the signs and symptoms of scabies? The hallmark symptom of scabies is intense itching that worsens at night. This relentless itch is caused by the body's allergic reaction to the mites, their eggs, and their waste products. Alongside the itching, a red pimple-like rash often develops on the skin. These itchy bumps can occur anywhere on the body but are commonly found on the hands, feet, and genital area. One of the telltale signs of scabies is the presence of burrows. These appear as tiny, irregular lines on the skin and are created by the female mites as they tunnel into the skin to lay their eggs. While these burrows can be difficult to see, they are often found in specific areas. Common sites include the webbing between the fingers, the wrists, the elbows, the armpits, the waistline, the buttocks, and the genital area. Your GP usually makes a diagnosis of scabies from the history and examination of the affected person, and a history from their family and close contacts. However, skin scraping microscopy can be used to confirm the diagnosis by looking for the presence of mites, eggs, or fecal matter. How do you treat and prevent scabies? The good news is that scabies is treatable. The primary treatment for scabies is a topical medication called permethrin 5% cream. This medication is a type of insecticide that effectively kills the scabies mites and their eggs. It can take up to 6 weeks for symptoms to develop after you've been exposed to scabies. So everyone who needs treatment must be treated on the same day. After the scabies mites have been eliminated, it's normal for the itching to persist for 2 to 3 weeks, and in some cases it may take up to 6 weeks for it to completely resolve. Here's how to properly apply permethrin 5% cream. First, bathe or shower with soap and water and thoroughly dry your skin. Next, apply a thin layer of permethrin cream to all areas of your body from the neck down, including the genital area, soles of your feet and between your toes. Do not forget to apply the cream under your fingernails and toenails using a cotton swab. Leave the cream on your skin for 12 hours. After this period, take a bath or shower to wash off the cream. If you need to wash your hands during the treatment, be sure to reapply the cream to your hands afterwards. The easiest way to do it is to put it on before sleeping, and after the designated time, wash off the cream thoroughly with soap and water in the morning. It's important to treat all close contacts at the same time, even if they don't show symptoms. Usually, anyone who is infected will receive a second treatment 7 days after the initial one. However, close contacts who do not exhibit symptoms may not require a second treatment. This helps prevent the spread of scabies and reduces the risk of re-infestation. In addition to the cream, your GP may recommend other treatments to alleviate the itching and discomfort associated with scabies. Antihistamines can help reduce itching, while corticosteroids can soothe inflammation. How to prevent re-infestation? While permethrin cream is highly effective, as mentioned previously, it may take several weeks for the itching to completely subside. This is normal, and it doesn't necessarily mean the treatment hasn't worked. However, if your symptoms persist after treatment or you have any concerns, seek further medical advice. Preventing the spread of scabies and avoiding re-infestation requires vigilance. Ensure all bedding and clothing used in the past 3 days are washed at 60 degrees Celsius in a washing machine or sealed in a bag for 3 days to kill the mites. Ironing your washed clothes and bedding can add extra effectiveness in eradicating the mites. Vacuuming furniture and floors can also help remove any stray mites. It is not necessary to fumigate living areas or furniture or to treat pets. See your GP if the itch persists longer than 2 to 3 weeks after the initial course of treatment. This is because sometimes the first insecticide treatment does not work, and you may need to use a different one like Cretameton, commonly called Urax, with or without a steroid component. Your GP may refer you to a dermatologist if your symptoms are not getting any better. The specialist can consider prescribing oral ivermectin. This medication can also be considered in an event of an outbreak where treatment of a large number of people is required. Thanks for watching.